Hey everyone, welcome back to the Vital Nourish. Today we're diving into a topic that affects many men worldwide: erections, sexual health, and how modern medicine and natural remedies can help when things aren't working as they should. Believe it or not, the story of Viagra started completely by accident. Back in the early 1990s, researchers were testing a drug meant to treat angina pectoris, which is basically chest pain caused by restricted blood flow to the heart. Angina happens when the small coronary arteries that supply blood to the heart become narrowed, and the heart struggles to get enough oxygen. They hoped this new drug would help people with heart problems, but the experiment seemed like a total failure. After just a month, with no visible results, the researchers decided to stop the study and withdraw the drug from all participants. Everything seemed over, until something incredible happened. Just days later, patients and their partners began lining up at the research center, asking for the drug. It turned out that while it didn't improve heart function, it had an unexpected side effect. It improved erections. And that's how Viagra was born. The discovery transformed men's sexual health worldwide forever. Now, let's talk about how these drugs actually work. The active ingredient in Viagra is Sildenafil, which helps protect and support erections. During arousal, blood vessels in the penis relax and allow blood flow, causing an erection. Scientists realized that nitric oxide is the molecule responsible for relaxing those vessels. There's also an enzyme called phosphodiesterase type 5, PDE5, which breaks down nitric oxide and limits its effect. Viagra, Cialis, and similar medications work by blocking PDE5, allowing nitric oxide to do its job and improve blood flow. The result? Stronger, longer-lasting erections. Of course, like any drug, there are safety considerations. If an erection lasts too long, typically more than 4 hours, it can cause tissue damage due to lack of oxygen, potentially leading to scarring. For most men, erections last just a few minutes up to an hour, which is perfectly normal. Risks are generally higher in younger men with fully functional erectile mechanisms, but the medications are most beneficial for men who may have cardiovascular issues or narrowed blood vessels affecting sexual function. Even though Viagra and Cialis work similarly, they have some differences. Viagra. Effects last about 4 hours, can occasionally cause temporary visual changes, like a bluish tint or mild digestive issues. Cialis lasts up to 36 hours, usually taken in smaller daily doses for consistent readiness. Side effects can include mild back or muscle pain. Serious risks are rare, but men taking nitrate medications, like nitroglycerin, must avoid combining them with PDE5 inhibitors, as this could dangerously increase nitric oxide levels. Men with severe heart conditions or kidney-liver issues should also consult their doctor before use. Sometimes these medications might not work. Common reasons include incorrect dosage. Doctors usually start low to gauge tolerance. Performance anxiety. Stress and anticipation can interfere with natural arousal. Alcohol. Excess drinking can block the medication's effects. If Viagra or Cialis aren't enough, there are other solutions. These include penile injections with medications that induce an erection, and vacuum erection devices, which increase blood flow mechanically. Surgical implants, either semi-rigid rods or hydraulic pumps, which provide a permanent solution for severe cases. But if you prefer natural options, there are some surprisingly effective foods and lifestyle changes. Cacao, rich in flavonoids that boost nitric oxide and circulation. Pistachios. Daily consumption can improve erectile function, as shown in some studies. Ginseng, ginkgo biloba, and ginger help support blood flow and general sexual health. Exercise. High-intensity training and strength work improve circulation, testosterone levels, and mimic some effects of Viagra naturally. It's important to note, no food, supplement, or surgery will permanently enlarge your penis. Focus instead on overall sexual health, pleasure, and connection with your partner. Communication and intimacy often matter far more than size. To recap, And Viagra and Cialis are safe and effective, especially for men as they age. The side effects are usually mild and temporary. Young men generally don't need these medications. And natural approaches like exercise, flavonoid-rich foods, and certain herbs can support erections. And for cases where medications aren't enough, injections, vacuum devices, or surgical solutions are available. Sexual health is a normal, important part of life. Don't be embarrassed to talk to your doctor or even your friends about it. Share this video, subscribe to the Vital Nourish, and stay tuned for more evidence-based tips on living a healthier, more vital life. Thanks for watching, and we'll see you in the next video.